Welcome back. We now move on to our final discussion on supplier engagement. The NHS has made it clear it will maintain a transparent process to maintain a structured and professional relationship with suppliers, introducing guidance throughout the procurement process. New and existing suppliers are now to conduct business through the Trust Procurement Department, and visits from potential suppliers are to be arranged by appointments to bring a reduction in cold calling. To reduce any bias within procurement, suppliers will no longer be able to send gifts or any form of samples to NHS staff without prior agreement through the procurement department. These aspects are in place to help stop corruption. So let's meet our final panelists of the day. They are Brian Mangan, who joins us again, Value-Based Procurement Project Lead, NHS Supply Chain; Carol Callister, Head of Category at NHS Supply Chain; Connor Almond, Procurement Manager for Oxford University Hospitals; and Penny Green, Procurement Director, NHS Commercial Solutions. So welcome to the final set, a full house for the final debate. Brian, may we kick off with you about what exactly is value-based procurement and why is it so important? Oh, I think we just need some sound on you, Brian. Let's try again. You got sound on, Brian?
Can you hear me now, yeah?
Now we can hear you, Brian.
Great, okay. Value-based procurement. So it's basically, it's not rocket science. It's, if you like, it's about whole life cost of healthcare. So it's really, it's looking at not just the price of the product, but really focusing on the pathway and seeing, what efficiencies, what cost savings can be driven throughout the pathway. And it also focuses on the patients as well. So it's looking at patients' outcomes. So it's really trying to sort of broaden what procurement look at. I mean, if you take a product, it's probably about 10 to 15% of the overall cost of the treatment. So what we're saying is it gives the NHS greater opportunity to sort of, again, to use the phrase, drive value, if you like, through the patient pathway. So in effect, that's what VBP is all about. And there's obviously a very strong link then to engaging with suppliers, which I'll talk about a bit later on.
Okay, well, let's move on to Connor. Connor, do feel free to build on what Brian said there, but also what considerations should we have when we're engaging suppliers?
I think of supplier engagement as a sort of a continued process. So it can be all the way from the early supplier engagement all the way through to the sort of partnership forming and the supplier relationship management. So I think there's sort of a few key areas around who we engage with, how we engage with them, and what sort of mechanisms we can put in place to actually drive the results that we want out of the engagement we're having. So I think sort of who we engage with, it's sort of understanding who's in the market, understanding who can provide what for us. It's understanding how we find that out. So is it through direct dialogue? Is it through posting opportunities to the wider market, or utilizing some sort of expertise from some of the framework providers that we have out there, and making sure that we're sort of doing that in a way that's sort of following the principles around non-discrimination, equality of treatment and transparency, and then sort of how we structure that to make sure that we have the clear communication channels that we need, and how suppliers can support us in sort of driving the benefits that we can really drive through our supplier engagement.
Carol, how do you measure the impact of supplier relationships, and do you perhaps have any examples that you can share with us to illustrate that?
The simple answer really on how to measure is ask them, is what we're doing working for you? Are you getting the engagement that you think works? Is this bringing what you need out of the relationship? But there's obviously a number of methods that you can use. So informal feedback based on conversations with suppliers, absolutely, but also with other users, customers, other stakeholders, probably not formally captured, but giving a flavour of opinion from different sources. And then we've obviously got the more formal and measurable interviews and surveys. But we've got to have a consistency of questioning if we're going to do that, to make sure that we do capture the right information across the board. We use...
I was just going to say, I think just talking to them makes so much sense, doesn't it? But interesting to learn the sort of more formal methods.
So surveys on from a range of interested parties, those who are impacted directly, and those sometimes on the periphery, so that you get, again, a different perspective based on whether it's somebody that you're engaging with, absolutely on a one-to-one basis, or someone who's outside of that. The way that we work with our framework agreements means that we've got to have both of those in our eye line, because we're working with customers directly and indirectly, and equally working with suppliers indirectly as well.
Penny, let's bring you into the conversation. What are the challenges in assessing the contribution of social value for procurers, and how can suppliers help procurers in their submissions?
Well, it's a big question. I think that social value, it can be easier in some areas and categories than others. But I know with the new guidance, we obviously need to be putting in 10% on everything. So for me, I think one of the challenges is what to ask the questions on and what to evaluate. So, I think Alexandra mentioned it earlier, not trying to assess everything, not asking 12 questions with a really small percentage. So which are the key ones? Making it clear to the suppliers and make sure it's proportionate. And I think from this, there's a lot of toolkits that are being developed, like the Modern Slavery Assessment Tool and Evergreen, which will enable the suppliers to work in one area and not have to answer lots and lots of different tendering questions multiple times. And that will mean that the suppliers are freed up to really focus on their developments in those areas. And I think actually there's a lot of really good guidance out there, so suppliers can start actually really thinking, how does it apply to their areas? And working in partnership. And for me, I think it's as Connor said, it's across the whole life cycle. It's not just that you do it a tender and it's in the contract. It's also, how do you make sure that that's being delivered and it keeps being up to date as our social value and sustainability journey develops and emerges over the coming years, and we move towards some of the targets that we're trying to aim for. So I think it is working in partnership on those areas, and asking the questions to see which are the innovative areas that are coming through.
Brian, let's go back to you. What is the relationship between value-based procurement and the supplier relationships?
I think it goes back to the if you look at traditional procurement, I think, like, I've been in procurement a number of years, and it's been quite adversarial. And I think the thing about when it comes to value-based procurement, because it's not just about product, it's potentially about a product and a solution. It's really about partnership work, and it's moving towards a more a trusting way of working with suppliers. And I think that's one of the things that we need to get over, because we do need to see them. Traditionally, I think we always had this divide, or maybe it was just me, where it's them and us. And I think what VBP is about, it's about asking different questions of suppliers. The quality of the answers you get depends on the quality of the questions that you ask. And I think for me, it's very much about engaging with suppliers in a different way to say, okay, we've got challenges within the pathway. How can you help us? What products have you got? What solutions have you got? And then it goes right the way through then to, how do we actually contract for value? And there's got to be this strong relationship that's built between buyers and suppliers. And it's something that, traditionally doesn't exist, but there are a number of really good examples in the work that we've done over the course of the last few years. So for me, suppliers are very much part of the solution, and they're integral to the application of value-based procurement. Is there
an example, Brian, perhaps you can share with us there?
Yeah, I think there's one. We've been working with Connor in Oxford, where we engaged with a supplier there, and it was a fairly big project. It was around an OPAT service. And again, so there were a number of parties that were involved there. So there was the supplier, the regular communications. They came along with a solution. Connor was involved in procurement. We had the Academic Health Science Network and also the clinical people. And we were all focused on very much in delivering this solution. And then the benefits from that have been that there's a service that enabled people to have their antibiotics at home rather than occupying a bed for 10 days. So you've got like a tangible and measurable benefit of an example of where working closely with the supplier, looking at a new technology, has actually delivered an improvement to the pathway, and it's better for the patients as well.
Yeah, I love those sorts of examples because it brings what we're talking about really to life. Do you want to add anything there, Connor, as you were involved in that with Brian?
Yeah, I think that the main takeaway from that was not only the operational benefit of freeing up bed space and allowing us to do something else in there that obviously we wouldn't have been able to do otherwise, but also was the patient feedback that came back via our clinical teams to say, actually having our treatment at home rather than having to be stuck in a hospital bed actually had a massive impact on their sort of patient experience as well.
That's great. Carol, any thoughts of how else we can improve supplier engagement? What are your little gems that you rely on?
For me, it's always about trying to work in partnership and trying to position your relationship with them at the beginning. That Brian sort of used the sort of adversarial them and us, and that is often the case when it's supplier and customer or supplier and framework provider. And it's about trying to say, well, actually, we're in this together. We're trying to provide the best solution possible for the customer at the end of the day, trying to get them the best value, trying to make it as easy as possible and trying to smooth the path. So can we work together to do that rather than, separated?
Great. And Debbie agrees. She says building relationships and trust should always be at the heart of any project, and also collaboration is key, isn't it? I think our last speaker, Alison, was saying that she was delighted to see that collaboration was back in, and that's at the heart of it all too, I think. Penny, trust capacity is limited. How can supplier management be approached to optimize resource, time, and impact when capacity is so limited?
Yeah, it's really interesting. We all know the world of pain that everybody was in during COVID, and it's just not stopped. There's just so many pressures, and it doesn't show any signs of letting up. So we've been working with a number of trusts, and a lot of it's been on where's the effort and impact. How much effort, how much impact, which one's the priority, and trying to do some supplier segmentation on those areas. And so you sort of start forming key supplier lists of which are the ones that are going to have a really big impact if you're not managing them appropriately. And then I think that there's the collaboration that you're mentioning about where are your partnerships, where within the either ICS or regionally, to be able to manage those suppliers in a collaborative manner. Even if you're on different contracts, you could have the same meetings to actually discuss where you're going as an ICS, for example. And also there's a number of initiatives, we obviously do things at a framework level, but there's also initiatives with the centre where we're looking at actually with some of the market developments or risk mitigation, should some of those conversations be happening at a more consolidated or national level, so the supplier is not having multiple conversations trying to fix the issue, and then it's about how that's disseminated. And I think I think just working together and sharing best practices so that you're not on your own, you don't have to reinvent the wheel, and finding out what suppliers are doing for others as well. So I think that can mean that the trust's resources goes further in these.
Just briefly, Penny, has it helped? We've talked in the past of try to find some positives in the pandemic, but being able to have the event that we're having now and be able to look at the four of you as guests, has that helped when you've been able to or teams and have various different people at the table? Has that saved a lot of time as well?
Absolutely. I think that being able to arrange meetings quickly, have multiple stakeholders in a meeting very quickly and in multiple trust formats, not just cut down travel time where you were always traveling, and actually that's now in productive meetings. I think there is still a real value of face-to-face, and it needs to not be lost, but certainly I think that collaboration has increased, and I think it's increased at the trust level as well. What our trusts are saying is actually they've really formed those relationships that they're able to use now in their working practices.
Fantastic. Brian, I've got a bit of a double question for you. So I'll start with half the question first. What do you think the NHS could do differently to work with suppliers?
I think it's a bit of a, if we think about how we manage our staff, so I kind of use the theory, McGregor theory, X and theory Y. So McGregor is like theory X is, we're quite adversarial with our staff. We treat them a certain way. Theory Y is we're very supportive. So the way we manage our teams, we have personal development reviews, targets, objective settings, all these things. And I think there's a real opportunity to sort of take that as a concept, as a process, if you like, and start applying it to how we manage our suppliers. Because we wouldn't let our staff go and only meet them once a year. We'd have a regular meeting with them, see how they're getting on and all that kind of thing. And that's just the norm. So for me, it's about really applying the principles that we know work, because they do, into seeing, the suppliers, if you like, an extension of the workforce. So for me, it's something relatively straightforward that we all do on a regular basis, and applying it to how we manage the suppliers.
So let's flip that round, Brian. What about the suppliers? What could they do differently to work better with the NHS?
I think it goes back to, over the years we've seen quite a bit of sharp practice by industry, and it's getting better. And we've seen through COVID that they've gone the extra mile. They've really tried to make a difference. I think again it does lead to the transparency, but it's about suppliers, particularly in the value space, where they come to with new propositions. It's about them building trust with the NHS and procurers in general. So it's making sure that when they're coming to meetings and they're coming in with proposals, they're not trying to, I use the expression, market value out of something that's not there. It's being very clear about the benefits that it can deliver, how it can be delivered, how it can deliver it, and being able to assure the things will actually be delivered. So it's having that integrity, if you like, and moving away from again, the way things used to be. When I started back in the NHS back in 2004, that would be my recommendation to industry, is play it straight.
Carol, anything you want to add there before I ask you your next question?
No, I think actually Brian's covered that one pretty well.
Summed it up very well. Is it necessary, Carol, do you think, to formally manage your relationships with the suppliers?
I would say yes and no. It's useful to have an understanding, obviously, of how often you'll meet, a standing agenda, what you're going to talk about. But I think if this isn't mutually beneficial and appreciated, then it has the potential to become a chore rather than actually a relationship building exercise. And you need to play some aspects of it by ear and be prepared to vary from the formal plan as necessary. If something's gone wrong in a relationship, if there's an issue with product supply, something like that, you need to be able to work on that in a very, as is necessary to do so. But you're still going to need to have that sort of regular understanding of where you are, making sure KPIs are being met, making sure that responses to customers are going through appropriately. So you'll have, I think, a bit of both, and you're always going to have a bit of flex.
Yeah, Penny, would you agree with that?
Yeah, and I think similarly, first of all, not all suppliers are the same. They all have, there's different market conditions, there's different impacts, and different personalities in the room. So I think for me, it's about how do you bring the best out of your supplier? And I think I agree. I think sometimes it's formal, but sometimes I've been in supplier meetings and it's so formal, there's no wiggle room. And actually, you're not asking the right questions. So it's around how do you make sure you build appropriate relationships according to the market conditions that you're dealing with and the impact. So yeah, I would agree.
I've got a question. Penny, perhaps you can take this from the floor. What can we achieve communicating with suppliers, considering public sector regulated procurement? How much shall we be able to share our findings with other trusts due to GDPR and competition regulation?
I find that suppliers quite often want to share their good news stories. It's part of their marketing. They want to say that they're great at doing something and working through that. And, you can do that without sharing a lot of the commercially sensitive information. And if you work in partnership with the suppliers in terms of sharing where something's gone right, I mean, the good news stories, we always hear about the bad news stories, but actually it's the good news stories that you really want to be able to be replicating. And I think that, yes, PCR is a limitation, but it's about understanding how you use that. And if you build your contracts in the right way, that has continuous improvement and it's got for the aim of the NHS system overall, then I think it's not as big a barrier. But I think it depends how you've gone out to the market and how you nurture those relationships as well. I think if you're dealing with someone who's very unhappy, they normally can pull apart and make something difficult if they need to. It's about trying to get those relationships right in the first place so that we're working in partnership for the best value of the NHS, which actually a lot of suppliers buy into. They're all part of, they need to go to the NHS themselves. They want us to be a success. It's just about how we get the best out of them.
Absolutely. Connor, in your opinion, what are the key benefits of supplier engagement?
I think one of the key benefits are really understanding how suppliers can support us in some of the challenges we face at the moment. So whether that's operational pressures of beds or A&E admittance, whether it's supply chain disruption, elective recovery, I can go on and on and on about inflationary cost pressures, sustainability. There's so many different factors that we're facing at the moment. And it's really understanding and having an open discussion really to see what solutions can be provided from the supply base to help us actually unlock some of the benefit that they can provide. So I think there's obviously things about how we utilize and unlock that, but also how do we work with them to have access to early access to technology. I think anyone who's ever worked with a clinician will tell you that they always want to be the first to try something. They want to be at the forefront of doing things. And through some of the sort of engagement with suppliers, we can actually put ourselves in positions to be sort of the early adopters of these technologies and therefore reaping the early benefits. So I think there's lots they can do. I think it can also drive some competition within the marketplace if you're engaging multiple suppliers, and actually that in itself can drive future innovation and actually support what we're all trying to do, which is providing better patient care that's sustainable in the long term.
Of course, that's always at the heart of it, isn't it? And I was listening, Connor. I was looking slightly distracted because I'm just trying to monitor what's coming in on the right-hand side of the screen. I'm going to go for this one, Brian. I haven't had time to read all of it, so I'll read it as we go along. But Leanne says, totally agree with Brian with regard to bringing the benefits of the proposal to the table. How can this be achieved better when some of the key stakeholders are often outside of the lab, not the direct customer, and harder to reach? For example, tests that improve patient pathways have health economic benefits and efficiencies. However, the savings are not realized in the lab budget. They'll be gained in the wider financial picture. So often we need to involve trust finance. These relationships are harder to build.
Yeah, I think I've seen the work I've been doing in the last few years, I've seen a change in the attitudes of finance. And there's a piece of work that I'm doing at the moment with NHS supply chain to get the relevant people around the table to start looking at how do you recognise efficiency benefits. I think the days really of silo budgeting, are on the wane, and I would suggest that a conversation with the finance director either at the local hospital or an ICS or ICB level is the way to go about it, because we are, it's daft, isn't it? It is what we're trying to do with VBP and these solutions is to say potentially you might think a cost in one area, but it will reduce the cost of the whole health economy. And I think that we had a conversation this morning. I was on the ICS panel, and I do believe that ICSs really will go a long way to reducing these barriers. So hopefully that answers the question.
Oh, hopefully it does. Hopefully that gives you the answer you wanted, Leanne. Brian, just stay with you a second. Do you have any examples of supplier behaviours that have caused problems? We all like great news stories, don't we? But on the flip side, any learnings you can share with us on that front?
Yeah, I think it goes back to the suggestion that I made before. As part of the pilot process, we engaged with 27 suppliers, and we had one example where we had a supplier coming in. And the pitch was quite strong, and he was saying, we've got this solution, it'll save you 3 minutes in theatres and it's going to save you £2 million. And
wow.
it was just a question of saying, well, no, it's not going to do it. And then, if you looked at the actual sort of the mechanics, if you like, if you put it into a spreadsheet, say it'll work, but on a practical level, it won't work. And I think that is something where you're questioning, well, what else are they saying? What else are they trying to over-egg? And I think that's where it goes back to what I mentioned before, because it's about this thing about marketing value out of something that's not there. So I think even if there was one takeaway for any suppliers listening to us today, it's that it's about playing it straight and saying, okay, what can we what is there a direct correlation between the introduction of the solution and the benefit that's being delivered, and so to use the expression I said before, playing it straight.
Yeah. And similar question to you, Carol, really. I mean, is conflict always a negative, do you think, in supplier relationships?
I think not, no. We always think that it should be, but the difference of opinion, the subsequent discussion that might follow, can lead you to a new solution that might be better. It's not always necessary to smooth out conflict, I don't think, when it first appears, or to force one party to back down or to change their opinion, because conflict encourages dialogue, and I think dialogue gives an opportunity for a more thorough evaluation and perhaps a better understanding, so that those different perspectives can come out and they're allowed, equal consideration. And then you've got potential for change, innovation, progress, new ideas, open-minded approach. And again, it builds on the relationship that relationship of trust that you're trying to build with your suppliers. And all of that, I think, can positively impact the outcome.
Obviously, innovation is key, Penny. It's critical in delivery of pathway improvements. What techniques do procurers use to encourage innovation?
I think there's different techniques at different levels. So in routes to market, in certain areas where we want to develop markets or we think things are going to emerge very quickly, we'll actually consider putting in DPSs, because then you can bring in market entrants as the solutions progress. I think in terms of actual tendering stage of the cycle, obviously outcome-based specifications. And for me, when it's tendering, it's about scoring it. Actually, if you score it, it shows to the supplier that it's important. So asking suppliers at the SQ level, what have you done in past contracts for innovation? And then in the ITT level, getting some firm ideas of actually how innovation can be built into that particular contract. And scoring it, and you can build in gain share, so that actually if it's successful, you can share profits together. And then for me, as well as part of the procurement lifecycle, it's about then making sure it gets through into the contract management. Put it on as a standing basics, your standing agenda item around innovation or tender benefit realization. Actually, is that coming through into the contract? Is there something emerging? Making sure there's a continuous improvement clause in your specification and contracts, so that it's part of the contract that you expect it to grow and improve as its duration increases. And particularly for some of the contracts that are like 3 to 5 years, that's a long time. And if we think about how solutions emerge, just look. I mean, we're talking about pre-COVID. That's only a few years ago, and we've completely changed. So it's how do we do that in a contract so we don't have to go back out when something's working well with the supplier. And then I think one great thing about being in the NHS is we can talk to each other. Somebody else might be using the same supplier and getting a different innovative solution. So let's talk to each other and find out actually what is happening. And is that just that it's a different envelope, or maybe it's the same commercial envelope? And then having a discussion with the supplier, because they might not actually realise you're really wanting this. So I think it goes back to what was said earlier about talking to your supplier. Sometimes I've had people come in and say, we've got no innovation, and they've not even told the supplier or had a conversation with the supplier in the first instance. So yeah, I think it's those relationships as well.
I think as well, that's why events like this are key as well, because it does give a very free-flowing platform for people to come and listen to people like yourselves speak, and also ask questions and engage and share different things that are going on around the country, which is always really useful. I mean, Connor, we always say, don't we, in any of these NHE events, that it's patient care. Patients are at the heart of everything everybody's trying to do, and how can we use the benefits driven from supplier engagement to provide better patient care?
I think it sort of comes down to the old saying that if we do the same things in the same ways, how do we expect to get a different result? And I think that's obviously where we all are. We're all in a position where patient care is important to what we're trying to trying to do. I think obviously I've mentioned a number of issues and pressures that we all face as a system at the moment, but actually, as Brian mentioned earlier with the OPAT project that we looked at, actually having a better patient experience by being able to treat patients closer at home, which also had obviously a sustainability element of not having patients coming in, and an operational benefit as well. But also looking at some of the other issues around supply chain disruption, and actually are we having timely care of the patient? So are we making sure that disruptions in our supply chains aren't actually affecting any procedures or services? And also making sure that our patients are actually being seen when they can. So obviously the issues we have at the moment with elective recovery, any admittance that's causing pressures within the hospitals, by actually collaborating with our suppliers and engaging with them, being able to forecast what we're going to be looking at doing, whether there's any sort of service innovations there that can help reduce down stays, it can help our sort of flow of patients, then that's going to help us have the timely patient care, and actually help us have better patient outcomes in the long run.
Brian, Debbie asks, being a supplier of bespoke systems to the NHS, predominantly we've been approached by local trusts to build systems in collaboration with the NHS. What's the best way for us to approach the NHS, and what departments, as I found it difficult to speak with anyone? Any guidance for Debbie there?
Again, the work that I've been doing has obviously been through NHS supply chain. So I think it's maybe having a look. There's a website that I can get shared. You can go on there. There's lots of really good information. It gives the various contacts for the category tower. I've got a value-based procurement project lead for each tower. So I think really initially maybe try the NHS supply chain website. There's lots of useful information on that. And then from there, if there's a problem, my contact details are on there. Just give us a shout.
Brilliant. Thanks, Brian. Carol, again, just reading a question from Helen coming through. Helen says, even though supplier engagement is key for the NHS, it's still one side in some cases, as in due to unforeseen circumstances worldwide, and suppliers approach NHS with small cost increases were immediately issued with zero tolerance letters explaining the NHS will not tolerate any increases, even if the suppliers haven't implemented any increases over many years and have no option at the moment not to. The NHS isn't receptive to support suppliers. Just wondering if you can give any thoughts or advice there. Helen's obviously having some difficulty there, and the price rise is obviously troubling.
Absolutely.
Helen.
So NHS supply chain has long been known for having a zero tolerance to price increases from suppliers, and absolutely I accept that as a statement. Well said. But actually recently they have been more tolerant to it and are much more aware now of the massive changes in our global environment. And we have, again, I can only talk from the NHS supply chain perspective, a very particular protocol to follow. So if a request comes into a member of my team, they will do an analysis on that, they will review that, they will ask for additional information, justification, evidence, in which, so that they can analyse that increase is appropriate and can be submitted as such to Supply Chain Coordination Limited for approval. So it can go through. There is a process and a protocol that we follow for price increase requests, and then we will make sure that we engage with customers to advise them as early as possible that something is likely to come through, so that they can mitigate those increases by whatever consideration they can add.
Well, thank you. Good answer there, and hope that was useful for you, Helen. Final question of the day. Actually, I was going to say it comes from the floor. It doesn't, Penny. It comes from me. It's about sustainability. How can trusts progress the sustainability agenda at potential higher cost points at a time of inflation and obviously price increases?
I think that is a tricky one at the moment. I think we know that inflationary prices are causing budgetary pressures. And we need to progress the sustainability agenda, otherwise we're going to be in a real position of pain in the next few years as well from the planetary perspective. So I think there's different approaches. Some of the approaches that we're supporting at the moment are around demand management. Actually, there's a lot of sustainability where if you just cut out the demand on something, look at how much, so we've done things on MFDs and printing, and how much is being printed, and how have people reduced their volumes, and how has that been successful, and sharing that best practice. That doesn't actually change any of the contracting pricing. In unit pricing, it's actually just trying to make things more sustainable in terms of our outputs. I think also a longer term strategy around bringing in the right suppliers early to actually have a proper strategy. So we work with some of our trusts on 6 facet surveys, for example, to get a real approach to the estates strategy going forward, which then builds in a baseline around where is the sustainability in the estates and where are the opportunities, which then have a whole portfolio of projects that come after that in terms of how you're improving your estate with the long-term spend to save. So yes, there is upfront spend, but you've got a payback in the journey. But if that's tempered with the demand management, I think it helps. But I do think it's a particularly difficult time at the moment to do that. And it's really looking at, actually, is there legitimate spend? Have we slipped into old practices that aren't needed, and we're maybe buying things that aren't needed, and can some of that be saved? And making it transparent, bringing the report so it's everybody in the organisation can see where these trends are, because then they can question it themselves, because it's something that everybody's aware of nowadays. So making sure that people can see some of the reports that are coming out of the systems that are being developed.
Thank you, Penny. And on that note, that brings our final panel discussion to an end. Thank you very much to Brian for 2 appearances today, to Carol, Connor and Penny for a final and engaging and interesting panel debate. Whether you're one of our excellent panelists or in the audience submitting questions, taking the time to listen, or sparking conversations with other delegates, a big thank you from the team here at NHE365. I look forward to seeing many of you at our next event, which will be on NHS Estates. That takes place on the 24th of November. Please share the word with your colleagues, as we'd love to see even more of you at these events. If you're a winner in our gamification challenge, then the NHE team will be in touch to discuss your prize options. Separate to gamification, today's event, as you know, was CPD certified, with 1 CPD point earned for every hour of live content watched. So if you'd like your CPD certificate, then please email marketing@cognitivepublishing.com and that will be sorted out. So from me and everyone at NHE365, thank you for attending today, for giving us your time and attention. Have a great rest of the day.